Hello, everyone. Welcome back to the QueerCME podcast. One day I'll make an actual intro, like a fancy full podcast, but it's not today. I am so excited, Eli, to welcome you today. I've watched your work from shared social media circles maybe for like a few years. I don't even know, but we've never actually met. So I'm really, really excited to hear and learn more about what you do and to share that with the world. But I would love to let you introduce yourself.
Yeah, thank you. Yeah, same. I very much watched your work as well, and I've sent clients your direction, and it's exciting to be able to have a chance to talk. So I am a gender doula, and my sort of brand is the Gender Doula. Um, because when I started, there weren't really other gender doulas, and I was like, oh, I have to let people understand that this is a thing that exists. So I might as well just keep it clear. I have been working as a gender doula since 2020. I have a Ph.D. that is primarily in trans history and medicine and legal concerns. And I finished that in 2022. And I do many, many things as well. As a gender doula, I support folks of all different identities and at all different parts of their journeys with gender-related everything. And so I support folks who are questioning, folks who are exploring their gender, and also folks who transitioned like 20 years ago, but it was really traumatic and they need support in processing what they experienced at that time. And so it's a really broad scope of practice that's hard to boil down. But I will leave it at that for right now.
Amazing. And I do try at QueerCME to focus on lifting up voices with lived experience. Do you have any lived experience you would like to share that informs your work, in addition to all of your training and education that you have done as well?
Definitely, yeah. So I am trans, I'm queer. I came out to myself as trans and when I was 20, well, I was out to myself as non-binary for several years and then came out to myself as trans and started medical transitioning. And that was back in 2014 or 2015 is when I started hormones. I'm like, it's been a hot minute, right? So I'm almost to my 10 years on T. And so I do have that experience. And I have a variety of identities, as we all do. I have chronic illnesses. I'm fat. I come from a highly educated but not financially abundant background, and I'm sure many other things that may or may not be important in the space as we talk.
Yeah, thank you so much for sharing. And I feel like I don't always share all of mine, but we haven't met before, so just so you know who you're talking to. Yeah, I identify as gender diverse. I feel like trans as a umbrella term fits for me. Trans as like someone who's medically transitioned is not. It's not part of my experience of my gender or my body. And I think sometimes I use the word non-binary because other people understand it, but that's actually not how I feel. I feel like my gender exists beyond a binary. But anyhow, and then I'm queer, and I feel like often I have shared frequently in many spaces that I'm poly and kinky, and that also really informs a lot of how I approach things. And I have several chronic health conditions and I'm disabled as well. But then also have grew up in a fairly financially secure home and with people who had gotten higher education as well, and have the privilege of my whiteness surrounding me in all spaces as well. And yeah, I'm really happy to be doing this work and coming to the table together. I'm sure I forgot. Oh, I'm in recovery and survivor of sexual assault as well. I always forget those two. Oh, and I have autism. Okay, those were. I feel like that was I just popcorn those out there for people. Which in most of the spaces I teach and work have all come up at some point, but again, we haven't been in all of those spaces together. So now you know a little bit more about me, which is funny because we're on a podcast together. And the way my autism works, I'm not always great at asking questions. I'm really great at sharing a story to say I empathize with you. So we'll try. Yeah, I would love for you, the most of our audience is like prescribing clinicians. So people who like prescribe gender affirming hormones for folks and stuff like that. And so oftentimes are really a place that community members go to ask for like resources or like things to be help support them in their journey or their experience of their body or their gender or their health. And so I would really love you to talk a little bit more about, I know because you're like, this is a very broad overview of my work, but I would really love you to talk a little bit more in detail about like ways that you support people and like when it might be like a good time to think about considering a doula for someone in their journey.
Yeah, so I'm gonna answer this by starting with why I chose doula as the framework for the work that I do, which is a lot of folks are familiar with doulas in the realm of like the birth space. And I was actually trained by full spectrum doulas once I realized this is what I wanted to do, because of that skill set being so helpful across any threshold part of life, including birth or death or gender transition and more. And the reason why I chose doula as the framework is because doulas operate in a way that is adjacent to medicine and often deeply involved with medicine, but without being medical professionals, right? So the same way that a birth doula might be like in the birth room, like doing specific massage on the hips, right? Which is very helpful for the birth process, but also not what the doctor is going to be doing typically, right? Like that's kind of where my work sits metaphorically. And so, for example, there can be, regardless of a medical practitioner's intentions or bedside manner or whatever, there can be a power imbalance for most of us when we see a doctor.
Oh, I'm gonna do that annoying thing where as a doctor I interrupt you. Like there is a power imbalance. It's not can be. It is there.
Yeah.
All the time. 100% of the time there is a power imbalance, and clinicians were on top of it. I don't care if you're bottom in the bedroom, you're on top in the office. So and I think that's actually really important because I think this is, well, I just, that's it. That's all I got to say about that. You keep going. I'm sorry I interrupted you.
I completely agree with you. Right. And so like, it's really scary to be on the other side of that power imbalance. And especially when you don't know if your doctor is going to be cool about hormones or trans identity. And none of us really know, right? Like you can hear somebody's got a good reputation, or somebody can be like, I do work with trans people. That doesn't mean you're going to have a good experience in the room with them, right? And so, and I mean, I could go on and on, but I'm not going to. I'm going to cap that, and we can talk about more later if you want to. But basically, if a person is like curious, for example, about hormones or surgery or gender exploration, they're probably not going to, the doctor is probably not going to be the first person they talk to. And that is a place where I can help a lot of like, here, we're going to have like expansive time, right? Like it's not limited to however much time the insurance company has allotted that you're allowed to talk to your doctor or whatever, right? Like we're going to have expansive time to like really talk through this, to talk through the details. I have a variety of like resources that are like medical resources that I like walk people through in terms of like what to expect and like what the different impacts can be of hormones or surgery. And I also like help people, like I give them language to take to the doctor so that they can feel like they're communicating what they're trying to communicate, and whether that is like a bullet pointed list that we have come up with together, because in the moment it's really easy to forget you have questions or to be like, no, everything's fine. And like, not, but if you have a list, you can be like, oh, right. Like I wanted to ask about like, muscle growth or fat redistribution or whatever. Right. And so helping people sort of like come up with those lists, helping people do sort of the emotional work or the background work, and then holding people through the often like very challenging aspects of medical transition. And I work with people who are doing all sorts of transition, so it's not just medical, but with the pieces that would be probably most relevant to clinicians are the medical pieces. And so like holding people through the very complex emotional and spiritual work that happens during second puberty, that your doctor is just honestly not going to be able to hold you through.
Yeah. No, let me be clear. I don't want to hold you through it. Not because I'm an asshole, but I like don't have the training or the skill set that's needed.
Yeah.
Right. Especially like in the framework of Western medicine that I work within. Right. I was trained into patriarchy and the misogyny, of like, and like white supremacy and racism, like that is the legacy of my training. It is the, and it's like, it's something that I feel like clinicians like, and I work very hard to undo in my brain, but like, I have not gone to doula training, right? Like, and I don't really want to.
Yeah. Yeah.
I'm really glad that some people do and are present and available. But yeah, clinicians, I feel like sometimes that and like, right, in a lot of employed systems, like clinicians are seeing patients in 20-minute appointments, like once every 3 months, right? And there's just not, there's not space for that, like more intimate holding that like can happen in a doula relationship. And I think there's not time to build that kind of trust.
Yeah.
And I think I'm sorry, I'm trying to figure out how to pull this thread in, because I'm just thinking one of my collegial friends who's also been my doula at different times in different situations, we talk, and then one of my really close friends who's training to be a doula right now, we talk a lot about how in Western medicine and Western culture, like our healers are so separated from our own communities.
Yeah.
And this is something I talk about a lot in spaces where I'm training other clinicians, how like that was actually one of my fears going into the field. And that doing a telehealth model where I was seeing people in many states and not necessarily like doing in-person care in my own town felt like really accessible to me in a way, because I wasn't trained how to be in relation with my patients outside of that power dynamic. Right. And it's something that like as a community member, like is really different navigating. And I think, I don't know, it like gives me a lot of hope and joy to see someone approaching this kind of work in the way that you do. Right. And like, not that it's not nuanced, I'm sure challenging at times, but to like, I just think it's really a beautiful like history and tradition that you bring to the framework of like healthcare that we have in the current shithole that healthcare is in the United States. Right. And that it's like, it gives me hope for a future too, where like there is more space for there to be more connection, and less power differences and dynamics. I don't know if any of that made sense at all. If you want to find a thread in there, or I can try to come up with an actual question.
Yeah, well, it actually reminds me of like, so I do feel like one of the things that I'm very interested in is working with clinicians, and I've done trainings for therapists that I think have been really helpful. Well, I know have been helpful; they've told me so. But I've done trainings for therapists that are really lovely about transition as an embodied experience and how to lean into the embodiment of transition with clients. And I'm really like interested in working with clinicians also to sort of be like, okay, let me help you understand everything that's coming into the room when you're sitting with a trans client, right?
Yeah.
Because part of the advantage of my Ph.D., like I have this huge like academic background of doing all this research, and a lot of my research was about like, wait, why the fuck is trans medicine like this? Right? Because I think very early on in my academic work, I was like, oh, there's got to be a reason why we require a letter from a mental health professional. So what is that? And that's literally my dissertation, because I just couldn't let go of that. Like, why does this letter exist? Where did it come from? It came from Germany, early 1900s. Could tell you the whole story, but yeah, I feel like if clinicians understood the full history of why trans medicine is what it is, it would be so helpful in knowing the depths of fear that patients are in when they're coming into that room, and the specific valences of that power dynamic in this very particular context of gender related medicine.
I'm multiple responses to that. One, you can absolutely come on the podcast and tell the history of the letter another time, if you're up for it. Two, that would be a phenomenal session for prescribers to experience. And I'm absolutely helpy. That was me trying to say I'm absolutely happy to try to be helpful in supporting you.
I love helping. That's great.
So I'm happy to talk about that after this, because I think that would be phenomenal. And it's so funny. One of the sessions that I've been doing a bunch this past year that I love is I do a session on what is cisnormativity.
Yeah.
And I'm okay, we're gonna roll it back to the agricultural revolution, because I need you to understand where the gender binary actually came from. Right. And how all of this is actually just tied to white supremacy and colonialism, and that you have been spoon fed this since you were a baby, because it's what keeps capitalism moving forward. Right. And so I love that session, but it is just an hour of me trying to give a broad overview of how this happened very quickly.
Yeah. Yes.
I feel like it would be phenomenal for people then to get to go to a workshop with you where there's so much more nuance and so much more depth to it. Right. Which is I would fucking love to attend that workshop. Absolutely. And then also this article just came out in July. I don't know if you've seen it. It's, I'm sure, again, a slightly different take, but it's the legacy of cruelty to sexual and gender minorities. So it's these authors actually reviewed all of the publications about LGBTQ people in the New England Journal of Medicine. And so it goes through the history of the New England Journals of Medicine's publications on queer and trans folks. And so it's an accounting of that journal's homophobia and transphobia. And so it's a really fascinating thing. They did these with racism as well. So a really great thing that I think the journal is doing, and highly.
I see friends and the authors. I know those folks.
I'm sure. And so highly recommend checking that out to our clinicians as well. But yeah, I think I'm with you, because I don't know, and it's just maybe how my own brain works, but I feel when I understand why I'm supposed to do something, I'm so much more engaged and willing to do it. And so so many times clinics or whatever comes to me and they're can you teach us how to be more affirming? And I'm well, you have to understand the root of where all of this came from, and why it's harmful for me to I mean, I can tell you how to use a pronoun, but you're not going to do it if you don't understand why. Right.
Not even not going to do it, but you're not going to do it right. And I hate to say right in that way, but also I'm going to say it because the thing is folks know when you're being performative. There's an energy, right? And I know this from my personal lived experience, but I also know it from listening to my clients talking about their interactions in the world, that they're I can tell that this person sees me as a man, but they're using they, them pronouns because I asked them to. Right. Or, right. I can see that this person views me as a woman, but they're using he, him because I asked them to. Right. It's you can feel the energy of I'm doing this out of obligation versus I'm doing this because I've worked with myself and I understand the purpose of it,
Right. This is one of those personal stories that I'm you're really going to tell this to the world. But one of like the most affirming experiences of my gender for me. So I had sex with this cis guy like fairly recently, and he was like, "You're nothing like fucking a cis woman," and I was like, "That's because I'm not."
Yeah.
Right? Like, but it was just like so. It was so. Yeah, it was just like so affirming because it was like, yeah, like, right, like all of your friends, because I don't hang out with any of his friends, I'm not interested in them at all, let's be clear, but right, like all of his friends I'm sure see me that way.
Yeah.
Right, and so many of my friends see me that way, even though like, you know, we've talked about my gender, but they've known me for 20 years, and so they've known me through this process of me figuring it out, and like I don't look any different to them.
Yeah.
And I like move through the world with the world seeing me that way. And so it's like really, it's really like complicated and nuanced, you know? And I think it is, there's such a difference. There's such a difference in like how people approach it. And I think that like performative component is like really important to take note of.
Yeah.
And I do think, yeah, I think it'd be like, when do you think about, because I'm going to guess the answer to this question is like, you think about people coming to see you at all different points in their journey. But I'm like, when would you think like about a clinician thinking, oh, I should think about finding my client a gender doula, or I should think about, you know, sending them to Eli? Like, when are you thinking about that?
Yeah, I think at any point where a person seems like they need more support, it would be helpful for them to see a gender doula, right? And like I'm thankfully not the only person doing this work at this point, and I am planning on starting to do a training for people in 2026. That's when I'm going to start training gender doulas. Yes, I'm very excited about that, because there needs to be more of us, you know, like there just needs to be so much more of us. And so like there are some folks, and I have people that I can send people to. I do try to list people on my website so that people can find, you know, other gender doulas if I don't seem like a good fit, or sometimes my books are full and I can't take folks, you know, and so there's that. And yeah, so anytime that somebody needs support, I think is a really good time to send them to a gender doula. I think that in particular, though, folks who have a more complicated experience, and what I mean by that is like, I mean, again, this is so hard because it's like this is probably everybody in some way. But when I find folks to really benefit from working with me, a lot of folks who come to me are neurodivergent. And there's a specific thing that happens, and I'm sure you're familiar with this, when you are learning how to mask or being forced to mask as like a younger person, that gender and masking for neurotypicalness get like locked together. And so it's really complicated, especially, well, I don't even want to say especially for neurodivergent people who mask. It's very complicated to peel apart the layers of what is my masking because I'm neurodivergent and what is my masking because of my gender. And also like deconstructing both of those things simultaneously is a lot of work and really scary, and it benefits from having someone to hold you really carefully through that process, right? So I would say like that's one case that I think is really important. Another one is if folks are in any way deviating from like the more loud narratives of transness, right? So there's this really loud narrative in the culture of like, if you're trans, then like you know for sure, and you maybe always knew, right? And you want all of these steps, right? And this is like kind of what's a super outdated narrative, but like it still persists, right?
Yeah.
And so I think that people who don't sort of fit into those boxes, or whose gender is not like in a strict binary, or whose desires are sort of like more expansive, right? Any of those folks are going to benefit a lot from having additional support.
And I think like the thing I would point out is like those people can do medical transition and get additional support at the same
Yes.
time. I think sometimes clinicians get really nervous, like prescribers get really nervous about prescribing hormones when like the goals aren't totally decided or clear. And especially if we're working with adults, right? Like there's a little more nuance to this when working with adolescents, but like when we're working with adults, I think it's like a trial of low dose hormones for someone, right, who's still trying to figure things out is like absolutely an ethical and like possible approach as a prescribing clinician if the patient has the capacity to provide consent and understands the risk associated with that and is still like interested in doing that. You know, and a trial of therapy is something we do in other health conditions. Being trans is not a health condition, but we're talking in that framework right now. That we do in other health conditions all of the time, right? Yeah. Like, you know, we are like, oh, it's like really common, I think, in an adult diagnosed ADD to be like, let's do a trial, like let's do a trial of a stimulant and see how you feel, because it's so hard to get neuropsych testing, right? Yeah. Like neuropsych testing is very hard to access. There's oftentimes very long wait lists, and like, you know, I've seen that come up in like, and in so many other places, right? With mental health medications, we're like, we're just gonna try a few until we find the one that works for you, and so again, really like, low dose hormones aren't going to cause any changes in someone's body overnight, maybe not even over a few months, but they're going to get to like experience like how they feel in their brain, which gives them more information about making decisions about what they want to do moving forward. And I think that's like really, really important. And so like these things can be done at the same time for some people, and some people might not want to do them at the same time. Some people might want to do them in different orders, and that's also accessible. But I think that's like my big caveat. It's to clinicians, like just because someone's goals aren't fully expressed or understood, right? That doesn't mean that trying something is the wrong decision in that situation.
Absolutely. And I will say, like, you know, most people I know hate the idea of goals for transition. Like, most people I talk to are like, oh, like I talked to my doctor and they asked me what my goals were, and it was so like annoying. And I'm like, yeah, I know. Like, it's super fucking annoying. So like, I know that that's a word that folks use and it's fine, but like also it doesn't hit for a lot of folks. And I'll say, like, we know from the research on something like regret, for example, that the most important part of medical transition is agency. It's a person having agency. And that even if a person, you know, gets to the other side of a medical procedure and has regret, the fact that they had agency in the process is a protective factor for how they process that regret. And like, one of the things that I like to talk about with sort of this idea of like trialing hormones or whatever is that like, going off of hormones is not a negative outcome. You know, like trying different parts of transition or different aspects of this like sort of gender medicine and deciding, oh, that wasn't for me, is not a negative outcome. That's a good outcome, right? Like, and even like trying social transition aspects, right? Like trying different styles of clothing, trying different names, trying different pronouns, right? Like the fact that that shifts over time is not negative, and it doesn't indicate anything about you, right? Like that can actually be an important part of the journey. And so like sort of this idea of like trialing things, I always tell a client, well, not always, but like based on my perception of a client and my work with them, I will often say like, oh, if you just want to try hormones, that's fine, right? Because there are things that you cannot possibly cerebral your way into, right? Like hormones are an embodied experience. You know, you can't think your way into what an embodied experience feels like. You can guess, but it's not the same. And for me, when I went on testosterone, I was fucking terrified, you know, and I had this weird feeling like I can't show my doctor that I'm scared because then she might not prescribe it, but like I'm terrified and I don't want to take too much and I have all these feelings, you know. And luckily I was working with a clinician who was very, very good and wonderful and understanding, and I think she probably would have been able to be fine with me expressing that, but I only knew that in hindsight. I met her the first time when I was going in for hormones, you know. Yeah. And so, but then once I'd been on testosterone for a couple months and I started to see really subtle changes in my body, every single little change was like so exciting and so fun to me. And that is what allowed me to finally be like, oh, this is a thing I wanted, right? So, but when I got on hormones, I wasn't even sure that I wanted them, and now having talked to thousands of trans people, I understand that there's no set outcome, right? You trial hormones, you may love it, you may hate it, you may want more, you may want less, like it runs the gamut, but you can't know until you've tried it.
Yep. Yeah. I love you sharing that. And I think it's so, I was working with a patient the other day who I was like, are there any like side effects you're worried about? And no, none at all. And I was like, let me be clear. You being worried about side effects does not mean you will not get a prescription at the end of this appointment. That's not what I'm saying. I'm just here. If there are things you're worried about, sometimes there are things I can do to help. Right. And so like, I'm here to talk you through all of the options if there's some things you're worried about. And I think it's like, I talk about this technique I use a lot of times called like yes and, which is like pulled from improv world. But when patients like come to me and they're like, these are the things I want. And I'm just like, yes, if at the end of this visit, that's still what you want, I'm going to do that for you. Even if it like makes no sense clinically, right? Because I need the fear out of the room to actually have a conversation that we can engage in together and can be like, they can hear me, and the reality is like, in my experience, like implementing that, I've never had anyone then like continue to go forward with something that like medically doesn't make sense. But I think if I had said, I'm not doing that as the first part of that conversation, we wouldn't have gotten anywhere, because all of this trauma history that you're talking about that happened to our community comes into the room with every individual, right? Like that's that history you're talking about. That is that workshop that I'm like, yes, please do that. I will help you. Right. It's like this, it's so interesting, right? Like this, it's like not generational trauma in the like classical sense of inherited generational trauma. And like trans people, we have to reinvent ourselves every generation because we're not biologically related. And it's like closely, intimately similar. And to me, in my brain, it's not my area of specialty, but that's like oftentimes the framework I bring to it. I also love that you're like, people don't like when we talk about goals. I'm like, that's all I want to talk about.
People hate
it. That's so fascinating. Is it the word, or is it the like wanting specific details about what people want to see in their body?
It's both. I think that it's really confronting when people say goals, because in order to reckon with the idea of a goal, you have to reckon with the idea of failure. So if I say, what's your goal? And you say, my goal is to be like a big muscle man, and then you're not a big muscle man, you're a little twink, then you have to be like, oh, I failed at my transition, right? Like, and I'm not saying that's actually real, but that there's such a heightened fear in the power dynamic it like contributes to this as well, that it's like, if I say this is my goal to my doctor, there also creates a sense of accountability. Like, now if that goal changes, I'm going to be scared to tell you that goal changed, right?
Oh, fascinating. So one of the questions I actually ask patients like very often in follow-up visits are like, these are what I remember your goals being last time we talked. Did I get anything wrong? Has anything changed? Is there any updates we want to add to this? Like, but also one of the things I say in visits oftentimes is that for some people, gender is a destination. For other people, it's a journey, and that there's like no wrong pathway to this. There's no right way to be trans, But yeah, I haven't really thought about it in that framework. That's lovely.
Yeah, it's complicated, right? Because like you have to have some way of asking, like, what are you wanting from this process? And sometimes the answer is, I don't fucking know. But people are scared to say that to their doctor. And so I understand goals in the shorthand, and I also heavily empathize with all my clients who are like, I hate it when my doctor asks me what my goals are.
Amazing. That's lovely. I think that'll change, like, because we definitely have this like as some of our pre-visit paperwork. I definitely think I'll like rethink about how I ask that question. I like still probably am going to leave the like, we have like a checklist of like kind of secondary sex character things that hormones will change or not change, like that but we might do other interventions for that people can just like go through. And I think that like, but maybe changing how that question is structured and maybe adding some additional options that include I don't fucking know, right? Which is an answer I'm as a prescribing clinician very comfortable with.
Yeah.
You know, but I like you setting it in the context of like failing, because I don't think there's a way to fail at transness, or
No.
and I feel like in some ways we're not even just talking about transness, like we're just talking about being the human you're becoming.
Yep.
Right. And there's definitely ways like I've disappointed myself and how I've shown up in the world, but I have not failed at being me. Right.
Yeah.
I'm the only person in the world who can do this.
Yeah.
And there's no like wrong way to figure that out.
Absolutely. And I think this is like the difference between like the stories and the fears people hold versus like reality, right? Like in reality, no one fails at being trans. It's not a thing that doesn't exist. But like there's this like thing that this story that people hold, and it's related to the idea of like I'm not trans enough. It's related to the idea of like I'm not a real trans person, I'm not a good trans person. Like there's all these stories and like these like fears and insecurities. And again, many of these are connected to history and how transness has developed in the Western world throughout the past, 150 years or so. But like it's this fear that people are holding in their body. And it's very strongly related to, I think, a lot of internalized transphobia as well, and like how we apply that to ourselves. And so again, it's not based in a reality of like you can fail transition, you can't, but it feels very much like you can. And even if these folks could be like, oh, I would recognize that for every other person on the planet, it's different when it's yourself.
Yeah, absolutely. I feel like I love this conversation. And how important it is to like keep that framework in mind, especially when there's so much like misinformation, malinformation, and disinformation coming right from like the Heritage Foundation and Alliance Defending Freedom. Like, right, this storyline that you can actually fail at being trans exists in the world like very harshly and very strongly.
Mm-hmm.
And that we as clinicians can fail our patients and supporting them in that way. And I just think that it's so important to like hold the vastness of the human experience like up to this like oversimplification of this like malinformation storyline about what it is to like stop taking hormones. Right, like that is such a like binary thinking approach that just like really fails at like just holding the complexity of human experience. Right.
Yeah, I think that's such an important piece of this. Like one of the things that I'm very preoccupied with lately is how the transphobic rhetoric has literally been the same for over 100 years. And I'm like, first of all, y'all, like get some new material. Like this is so fucking boring. But second of all, it's like the longer that they spin us around, like dealing with these transphobic like lines of thinking, or like these, if they can spin us around trying to prove them wrong all the time, we never have time to actually get to like the cool shit that happens when trans people like come together, and have an opportunity to like think and work together and talk together and ideate and like discover, right? And so all of this stuff, like I see as just like a big distraction. And I know that it's really important to fight it. And I'm very grateful to the people who are doing so. That's not my work. But like, I guess part of the way that I push back against it in my own way is that like I don't take any of it with any seriousness. Like I think it's all very unserious and I don't pay it any mind. And so like to me it's like, listen, if you want to come to me and talk about regret, let's talk about regret. I'm not scared of regret. You know, I've worked with people who identify as like detransitioning, and then I've worked with people who've made various choices and don't identify with detransitioning. You know, that doesn't scare me. The idea of you like regretting choices that you made for like gender related processes, that doesn't fucking scare me. Like, people regret going to grad school, they regret getting married, they regret their knee surgeries at much higher rates, and everybody's always pushing people to like do those things. So like,
Right.
can we just like take a step back and stop thinking that regret is like actually that big of a deal? It's not. Like, if you live your life, you will regret things.
Yep.
Who cares? Let that be part of your journey. Let it be part of what informs you and gives you the richness of yourself, you know? And so, like, I don't really give a whole lot of, and I think that it makes a lot of sense for doctors to feel very frightened and, you know, touchy around these topics, because there are people being sued and there are real world consequences. And I totally understand that. But on my side, working with like trans folks, you know, like, I'm coming with the energy of like, so what if you regret it? We can deal with that. You've regretted other things in your life. Let's talk about how you got through that, you
Yeah.
know, because you actually have those tools already.
Yeah. Yeah. I think, yes, right. I think it's really, really scary for people when we have this framework for regret. And I think it's sometimes scary for parents when I'm talking to them about like, yeah, your kid might not identify with this identity down the road. Like, research and literature supports that they probably will with these components in place that we've seen so far. And nothing's 100%. But like, I can't treat your future kid. I can treat your kid now. Right.
Yeah.
Which is like the same decision I made. Like, I took antibiotics for my acne in 2018 and it ruined my guts. And I like have never been the same kind of pooper again.
Yeah.
Regret that. I'm gonna regret it for the rest of my fucking life. There was like, and when you look at the statistics on doxycycline, the antibiotic took, it's like that happens less than 10% of the time, you know, but it happened to me and I wish I had never done it. But
Yeah.
I did, and now I live with it, right? And I think it's like it's really scary for people to like hear that framework. And I think one of the things you said that's so important for clinicians to hold close is that comment around agency. And I think the other one I would add to that I've seen like in the research and literature too is like the informed consent component.
Yeah.
That like people, one of the things that led to people feeling like they didn't have the experience they needed was like not having enough time to talk about informed consent with their medical prescriber.
Yeah.
Right. And so I think, you know, that's part of why I'm like asking someone's goals, although we'll change the language on that, before they see me, because it's like, I want to get all of that in advance because I want to spend the hour we have together going over treatment options for you and telling you as much about them as I can so that you can then make the decisions that are right for your body. And like a lot of clinicians don't even get an hour for that. Right. And so like, I think one, clinicians like, this is an important part of like advocacy and activism. It's like working within your institution and organization to find ways to make appointment times longer, or to set up a system where you're like, we're not trying to be extra gatekeepy with people. We're not saying like, oh my God, you have to come to like, you know, an appointment every week, but like to say like, you know, but like book 2 appointments back to back with me. So we'll actually end up having 40 minutes, like ask the front desk to do that. Or, you know, we don't actually have enough time in our first appointment to get through all the things we need to. So we are going to like, you know, go ahead and set you up for a series of appointments. So we can make sure you feel comfortable and confident and have the information you need, and we'll cancel any of the ones you don't end up needing. It's like a really important part of like creating content. So like, because not everyone can process all of that information while a doctor is looking at them.
Yes.
Right?
Yes.
So like have content online, like have it in written format, have it in video format, have it closed captioned, right? Like, so that people can like do some learning before they're in the room with you. And then after they're in the room with you, like, I think that's like so essential. Right. And I think like, it's like, you know, most important to me that like, yeah, you feel like you got to ask all the questions you wanted to ask. And like, you know, you're going to have more in the future, and that's fine. You can just send me a message in the portal. That's why we have DMs, you know? And so I think it's just like, it's like an ever evolving experience for people. But yeah, I feel like regret is part of any healthcare, and to be so afraid of it is not actually part of most healthcare. Right. And so I think that's like really true to like consider and reflect on. And I think it's like really, you know, I've been so far in my experience in my patients who have stopped hormones, like all of them, right, who have stopped hormones, it's like been part of their journey. And my patients actually haven't had regret around taking them. You know, if they have, they never talk to me about it. But I have a lot of patients who stay with me after they stop hormones, you know? And so we have like talks about it, like what's happening, what's work, you know, what, like all of the things. And it's sometimes interesting. Some of them stay with me for a really long time and I'm like, I'm not doing anything anymore. Like, I'm like, when do you want to see me again? And I'm like, 3 months. I'm like, okay. You know, yeah. So I feel like I've been, and I feel like it's such a sad thing to me that people who do identify as detrans or who do have regret, like lose all of their community, right? Because like they lost this community when they transition, and then they lose the trans community when they detransition. And it's like, that's, you know, that is, I mean, that's this whole thing, right? This whole like colonialistic system of like keep us fighting ourselves so we don't actually like fight the power that exists and separates us.
Because ultimately, like my take on it is that gender exploration is good for everyone and it's something everyone should do. You know, like regardless of how you identify, regardless of everything, right? And I think that in a world where we were all free to live as expansively as our souls desire to, that like people would make all kinds of choices and they might try something and they might walk it back and they might do this or that, and that it could just be like fine, like it's not a problem, you know? And the fact that we feel like so embattled that, and also like let it be said that like these folks that you mentioned before who are doing all this transphobic like fear mongering, they're doing this on purpose, because if they can create a, you know, a bad guy or a boogeyman within the community for us to focus on and to feel embattled by, then we have less organizing power and less energy to fight the actual problems that are happening here, right? And the actual folks who are creating those problems. And so like in my sort of practice and in my life, like I think of gender exploration very, very, very expansively. I think of it as something that everybody, including cis people, should be doing all the time, and that it is a process that you can come into a better alignment with your values and how you want to show up in the world, that is no longer constrained by somebody else's definition of what you should be, you know?
I also think this is a really important aspect for prescribing clinicians to experience as well. Like I'm femme as fuck, like that's like pretty obvious for most people visibly, but like I've tried binders, I've tried taping, like, right. I've tried packing, like, you know, all of these things that like are about like exploring gender and body presentation that like I can try without like any significant like long-term things happening to my body. I've tried. And that like lets me like, when we're talking about this embodied experience, right? Like it lets me be in a room with people and really have like a sense of like, it's not this, right? It's not the same as like binding in high school and like dealing with all of the things that happen around that. But like, I have some sense of like what a binder feels like, right? Like, you know, and like, yeah, like there's just so much that like we can try and can experience as clinicians that like help us have like more of a framework to understand like our patient's experience of something, which I think creates like a broader base for our empathy to show up in the room. And I think is really important as well. Okay, I feel like I have to let you go very soon. I'm gonna, because people do watch sometimes on YouTube. Most times people just listen, but for people who are watching on video, this is Eli's website. And so this is the resource page, and then I can go to the home page.
If you just click the thing at the top, I think
The
it'll take
button.
you to the
Okay.
homepage. Yeah.
And so I'll put this link in for everyone who's listening as well. If you want to find Eli there, and we will. Is there anything else you want to say before I stop the recording for the clinicians?
Oh, if you are interested in my work, you can join my newsletter. That's the best way to keep up with me, and you can do that on that website. I'm also on Instagram, and I do post on there somewhat regularly. But the best stuff is on the newsletter. That's where I keep my juicy thoughts. But thank you so much for having me. This has been such a joy to talk to you, and I'm so excited that we finally got to connect after all these years of being in each other's periphery.
Yeah, it's amazing. Thank you so much. Okay, let's stop our recording. And then seriously, have you presented at a medical conference before?
Oh, yeah.
Yeah.
I presented at Philly Trans Wellness. I presented at Australia.